All right. Hello, everybody. Welcome to our webinar today. First of all, I want to introduce everybody. We have Bree Adcock here from Tennessee. She brings to us 10 years of practice. She's been an esthetician and she's been a trainer. So she has all this great experience to bring to you. We have Dr. Beckman, who of course is the founder and CEO of Theraderm. He is also a biochemist and was recently appointed as a clinical associate professor at the University of Arkansas for Medical Sciences. Then we have Darla Smith, and she is our general manager. She manages the wholesale territory. She also manages all of our esthetician accounts, and then she handles the UK and a lot of other stuff that she does. So anyway, so she's really busy. And then I'm Christina. I do all the social media, emails, all that good kind of stuff. So today we are going to talk about unconventional acne treatments that aren't weird. And we just named it that because everyone has an Aunt Brenda somewhere who says, you know, eat a spoonful of sugar, 6 lemons, and stand on your head for 3 hours, and your acne will be cured. So this isn't like that. It's not weird. It's normal. It's practical. And so let's get started with Bree.
Well, hello, everyone. I'm excited for the webinar, the call today. This is going to be great information. Acne is one of my favorite topics to discuss because it is the most common skin condition in the United States. And so we are excited to learn lots about acne today, and I'm excited to have Dr. Beckman here with us to discuss all of these details. And so just some facts real quick about acne. Like I just said, it is the most common skin condition in the United States. It affects as between anywhere from 40 to 50 million Americans. And so acne can start to affect us as early as puberty. And it's going to affect almost 100% of Americans, teenagers. It's not restricted to any age group, ethnicity at all. It affects everyone. And acne affects 20% of adults. So it's very important that we understand how to help our patients with acne. We help them adequately. So as far as how do we get a pimple, so let's talk about that real quick. And if Christina, if you want to pull up that first slide, because that's going to give us some bullet points on what we discuss just over the next few minutes. There's only one way to get a pimple. And the most prominent way that we do get a pimple is going to be because of oil. It's our sebum glands. So when your face is affected by these oil glands, it overproduces oil, and a combination of oil and dead skin cells is what clogs that follicle, and it causes you to get a pimple because the bacteria develops, the P. acnes bacteria, because it oxidizes, and then in return you get either a papule or a pustule. As far as the outside triggers of acne, so that's going to be internally. It's the oil, it's the hair follicle, it's the clogging, it's the P. acnes bacteria. But outside triggers, or you could say extrinsic, would be, you can think of environmental factors, hormonal, genetically as well. And so then we tap into talking about stress, diet, exercise, and all of that, how it can play a role in affecting the acne. So when your client presents that initial assessment that you're dealing with acne, we've got to first determine what type of acne it is, because there is 6 different types of pimples. And you also want to know where is that pimple present in the skin? Is it more epidermal? Is it superficial acne, which by the way is the hardest acne to deal with? Or is it deep? Is it cystic acne, which is typically caused hormonally? So you want to look at the skin and you want to assess it. So as far as how do you assess the skin, and this is where Dr. Beckman can chime in and help us with this process, but you want to look for, is it rough to the touch? Is it epidermal? Is it more blackheads? That case, that's going to be because of lack of exfoliation. Okay, so it's that expedited cell turnover rate there's excessive oil and that follicle is getting clogged. Okay, so then the other type to look for is going to be more pustular. It's cystic, and that's going to be deep inflammation. And that type of acne is going to be contributed due to hormonal. It's internal inflammation, and then it's hormonal. So in that case, that's where the physician that you're working with, or you can refer to a dermatologist, would more than likely need to prescribe some type of either topical prescription or an oral prescription to assist in the inflammation and the hormonal imbalance in the skin. So Dr. B, talk to us more about the different types of acne, elaborate more on what I've discussed, and as far as when you assess the skin, the different types of acne and how you would help evaluate that. What are your thoughts?
Well, a number of things come to mind. You mentioned a while ago the ages that acne occurs. Actually, newborn infants can have a form of acne called cradle cap, and that's from the mother's hormones during that period. Those are not cases that need any kind of treatment. In other words, they're going to even things out as that newborn gets on its own endocrine system. When we talk about blackheads versus whiteheads, it's interesting to note that there's no difference in the sebaceous content, that little bead, if you will, that's the material that's blocking the follicle. The only difference is a whitehead has a film across the top. It's actually a skin film, like a piece of saran wrap you'd put over macaroni and cheese. In other words, it keeps the air from getting to that sebaceous material. When it's an open or non-covered acne, sebaceous material, the oxygen in the air causes it to turn black. So we see blackheads and whiteheads, and it's very difficult to extract a whitehead until you get that covering, that saran wrap like covering off. And you're going to talk more about that, I think, when we talk about when we're steaming and doing some other things, and how to easily accomplish some of those things. Excuse me.
Yes, exactly. So again, so that's very, very, very important, vital information, very helpful. So blackheads, again, are an open comedone that's been exposed to oxygen that's caused it to oxidize. So that's why the actual pimple it's turned black, because it's oxidized sebum. And then the whitehead, like he explained, it's like it has that film, that covering over it. So the way that you would deal with those different types of acne as far as extractions is different. So we can extract blackheads, but when you're dealing with a whitehead like milia, you need a lancet or a certain type of tool to actually break that layer of skin over that pimple to extract it. And then of course, so that's two types of pimples. And then there's two other types, which is papules, pustules, and those are the larger bumps that are caused when the pore becomes irritated. So you have hard raised bumps, and then you have where it's even with the skin, but it's inflamed and it's pustule and it's red. And then we have nodules, and then we have cystic acne. So those are the 6 different types of pimples that we discussed. So as far as how do we deal with acne, the most important part is making sure that you balance that sebum production. So we're going to talk about treating acne. And as far as the TheraDerm steps go, the toning step or the fruit acid exfoliant, or we also have in the reversion system, we have the toner that we use, the salicylic acid. That's so vital when we're dealing with acne, because we've got to get that sebum, that oil production balanced. And then of course, in conjunction to balancing that oil production, we have to make sure that we're exfoliating that dead skin so it's not causing that clogged pore. So a few things that I do in the treatment room myself is I really utilize the new peel excessively, and I also utilize the toning step excessively, because with a new peel, the first thing that I always do is when the client, we begin our treatment, I perform and I apply the new peel all over the skin. a thin, even application. Even if they have on makeup, if they have SPF, the first thing you do, remove that, then I cleanse. And then after I cleanse, I'm going to use the fruit acid exfoliant to tone. Well, then before I do extractions, I apply another layer of that new peel. And you guys, I steam with it. So steaming with that new peel, it acts as a disincrustation formula, and it's going to open up those pore follicles so that when you go to extract, it's the easiest process ever. You don't have to use excessive pressure. It's not painful. It's relaxing. And all that's doing is it's breaking away and it's exfoliating those dead skin cells in a gentle formulation using those enzymes. So it's not it's not exfoliating too much. It's just enough to be able to get our job done effectively as an esthetician. And you can also have your clients use that new peel twice at home when you first start their acne regimen. So as far as the 5-day at-home skin prep, what we're referring to here is when your client comes in and they present with acne, you're going to do an acne facial. And remember to use that tip of the new peel twice. And then after you do that, you're going to encourage them to purchase their at-home kit regimen. And the reason that we're doing this is because you guys, we're prepping their skin for them to come back in 5 to 7 days, 1 to 2 weeks for a Jesner's peel, which we talked about on our last Zoom call. And the process of prepping the skin is to balance that sebum, exfoliate that skin so that when they come in to get that Jesner's peel, their skin is prepped to effectively absorb that chemical peel to get it end result. So again, just prepping the skin, real simple. It's 5 days to success. So what we're going to do is we're going to exfoliate the skin with a new peel. We're going to cleanse with a TheraDerm wash. We're going to apply another layer of the new peel. We're going to leave it on the skin. We're going to steam the skin, perform extractions, remove it with a damp towel. Then we're going to cleanse again with the Reversions cleanser, pat the skin dry, and then we're going to apply the OPC serum because that's going to help with fighting free radical damage, inflammation, redness. And then we're going to apply the spot treatment with the Reversion spot treatment. They do that at night. And so they're going to do that take-home prep skin for 5 days before you have them come in and actually do a Jesner's peel. And you're going to have to do a series typically of the Jesner's peel. So remember, that's going to be every 4 weeks, and we recommend doing a minimum of 3. So as far as dealing with acne, that's the way you're going to perform it in the treatment room. And then you're also going to have them prep the skin at home for 5 days and then perform the series of the chemical peels. So Dr. Beckman, do you have anything to add to how we treat acne in the office or in our treatment room?
Yeah.
Home care?
If we can go back to that previous slide, those steps, the at-home part of it, that number 7, applying the spot treatment, that particular medication in the spot treatment is designed to actually prevent a pustular acne breakout from occurring. And the best place to use that, in addition to this particular protocol, is on an everyday basis. Most people, if you think about it, will notice that before they had a breakout zit, the night before they had a little tender spot or a little red spot. And if you use that spot treatment on that, it actually prevents that from occurring into a pustular acne. So there's less damage to repair when you get ready to do the other things. So that would be one little comment there. But I think you covered things pretty well as far as getting the skin ready to get optimum result from your peel. One thing that the new peel brings, as opposed to using lava soap or harsh granules, is you don't get any microscopic irritation. It loosens those things so they actually just wash out the dead skin cells and things that are occluding that hair follicle.
It's so important. Yes. The fact that new peel is utilizing enzymes and you're not causing those microscopic tears to the skin. And as far as prepping the skin, something to let your clients know, because acne can be, it triggers us emotionally. It can be painful, it's embarrassing, and all of the above. So to give your clients a time frame of hope, the cycle of acne, it takes about 8 weeks before they're actually going to see results, because that's important that you have that communicating of time with your client when they come in and they present with acne, because it's something that they've been battling for a long time. And so just letting them know, hey, look, we're going to get you started on a great regimen today. We're going to start your treatment. We're going to prep your skin. We're going to do a basic acne facial today. And then you're going to start this take-home product. And then you're going to come in 1 to 2 weeks. We here do every 2 weeks. We start their Jesner's peel in 2 weeks from the moment that they present with that skin consult in regards to treating acne. So they come in, they do the consult, we do the acne facial, they purchase the take-home Theraderm kit, and then we schedule their Jesner peel in 2 weeks from that appointment. So they come in, they get their first Jesner peel, and at that appointment, their initial consult, I let them know, hey, look, it's going to take about 8 weeks for you start seeing any changes with the acne. And also note that's the cycle of acne, but it takes 12 weeks for the full cycle of transformation of your skin, so that you can always give them a time frame, but yet you don't overpromise and underdeliver. It's so important. And the best part about it is when we are dealing with acne, we can all be excited because, you guys, chocolate does not cause acne. So that's so important, because I love chocolate, specifically dark chocolate. So they can still enjoy that as far as when they're presenting with acne, which is so important. So talking about the Jesner's peel, so when they come in 2 weeks from that initial skin consult, when we do the Jesner's peel, let's just recap that protocol real quick. So when we're doing the Jesner's, again, the first thing we're doing is that new peel enzyme. We're going to cleanse the skin with the Theraderm cleansing wash. And then after we do that, we're actually going to apply another thin layer of the new peel. And then we're going to steam the skin. We're going to remove the new peel. We're going to cleanse the skin again. And then we're going to use the fruit acid exfoliant. And then we're going to perform the Jesner's peel. And then remember, last week we learned about the indication of the Jesner's peel. And then we're going to follow through. After we do the Jesner's, we're going to do a thin layer of the Turnox peptide cream to cool and soothe the skin. And then we're going to put on a layer of the Platinum Protection SPF. So anything else that we need to discuss about the Jesner's peel, Dr. Beckman?
Well, I would make a comment in terms of makeup, and we talked about that. You and I had earlier. Most of traditional makeups, those makeups that most young women learn about from their sister or mother or go to the beauty counter, would be like putting, imagine you had a clear door and you put Vaseline on it, and somebody on the other side of the door doesn't look exactly like they would look through a clear screen. That's what traditional makeup is. It has an oily base. And what we're trying to do is get rid of oils that clog up the skin. The other option for makeup would be a mineral powder based makeup. And that's a reflective makeup. And that's the only makeup that will cover redness, say with a pimple or with a bruise after surgery. So that's my preference for makeup as far as skin health. To cover any blemishes, and that's usually what I'm seeing if I'm seeing a patient. I mean, healthy young people I see out at the restaurant, but folks I'm seeing in the office have some problem, and it usually involves a red or purple or pink or something we want to cover up. So mineral powder makeup, and there are a number of brands, and you guys know what they are. There's, I won't name them all, but they're easy to find, and they work really well. But the other thing about them is that they all release very easily from the skin, so they don't stay in clogged pores. So they're very easily removed as part of an acne protocol.
Absolutely. And then great information, very important, that while we're utilizing a skincare routine to treat the acne, and then of course performing the Jesner's peel, it's important that we're not wasting our investment and clogging the pores with unhealthy makeup. So mineral makeup is very important. It's very helpful. So one other thing I just wanted to talk about too, and Dr. Beckman, you and I had talked about this before, is there is a fine line when you're dealing with acne. So sun exposure for all of us, we should be getting that at least 10 to 15 minutes a day for vitamin D. And so small amounts of time in the sun can help and can be beneficial for helping with acne. We just have to make sure we're applying our platinum protection SPF every 2 to 3 hours. But again, just making sure, going for a quick walk outside, 10 to 15 minutes a day, getting some sunshine, and of course, just reapplying that SPF every 2 to 3 hours. So any comments that you have in regards to vitamin D, sun exposure, and acne?
Well, I think the heat from the sun is one thing that exacerbates an oily prone, acne prone skin to create more oil. So yes, limit of time out in the sun. It is important that we get actually some sun rays coming in because of vitamin D. But if we think about it, if you put a really good sunscreen on every morning when you first wake up and throughout the day, you're in and out of the sunlight itself. That sunscreen in 3 to 4 hours is not going to be 100% blocking. So unless your mama keeps you in a dark closet all the time, you're going to get enough sunlight exposure. So I would recommend to use a sunscreen every day starting in the morning, whether it's an acne patient or any other skin. Of course, sun is the primary cause of the aging changes in skin and skin cancers. So there's a reason other than just in acne patients for everyone to protect their skin from sun.
Yes. And one other thing I wanted to talk about as we were discussing that reminded me that's important, that a lot of people have questions about, is when we're dealing with acne and vitamin C versus OPC, and how important it is. We've, discussed the importance of acne and the reversions kit and toning the skin to balance the oil, and as far as using the new peel for extractions and that gentle form of exfoliation. But I feel like we need to touch base real quick and let the audience know about how OPC is safe and effective even if you do have acne, and the difference between the OPC and vitamin C, number one. And then number two, what I want us to discuss is how vitamin C can exacerbate the effects of acne. It can irritate it, but not the OPC. So tell us about OPC and acne and vitamin C and acne. Talk to us more about that.
Well, let's talk first about vitamin C. Of course, vitamin C is the only ingredient, the only chemical structure that can allow amino acids to hook together to rebuild protein. And that would be collagen, elastin, and skin cell walls and things of that sort. So we got to have vitamin C to get there. On the other hand, if you have an adequate dietary intake of vitamin C, it gets to where it needs to go. It's like if you were putting fertilizer on your plants and you could get it through an underground watering system, it would get to where it needs to be rather than putting it on the leaves. With vitamin C put on the skin, it's, well, all of the patents that Sheldon Pinnell developed, he's the main innovator for vitamin C. He died a few years ago, but Sheldon's patents prove that if you have a very high concentration, at least 18% vitamin C in a product, and you make it very acidic, which is harsh, you can make the vitamin C go a little deeper. But it's so much easier to put it in the irrigation underground root system to get it there. It does a better job with less irritation. OPC, on the other hand, well, one of the attributes of vitamin C also is it's free radical scavenger. OPC, the oligomeric proanthocyanidin molecule itself, is 20 times more effective than vitamin C. So it protects your normal vitamin C storage to be able to go make some more collagen or things that vitamin C needs to do. It's very calming to skin because it has a number of antioxidants besides just the lipoic acid, aloe vera, and some other things that are soothing and calming to skin. So you can put OPC on a raw skin surface with no damage to the skin and no painful outcome, where you put a really effective, by effective, in other words, a strong enough vitamin C topical product on a road rash skin condition, it's going to burn and sting and make some owies. So why use it if you don't need it?
And so explain that more of why OPC, why doesn't it burn like vitamin C? Is it because of is it the carbons? Tell us more of why that is, and why OPC. Is it because it doesn't oxidize? How is it delivered? Is it encapsulated?
Well, vitamin C burns because, as I mentioned, the formulations that we find in vitamin C topical products are at a high concentration, a very low acidity. And if you put acid on a raw place, it burns. I mean, if you had say a lady shaving her legs and she has some irritation, razor rash, and you put alcohol on it, what does it feel like? It's cool, but it burns. So the alcohol evaporates, but the alcohol itself causes a stinging sensation to the little nerve endings. And that's what vitamin C topically would do to an inflamed skin.
Right. Whereas the OPC doesn't cause that reaction because it's not an acid, correct?
Yeah, it's very soothing to put OPC on a sunburn, for instance, where vitamin C necessarily wouldn't have it.
And it's not going to cause more breakouts. It's actually going to help internally the inflammation, calm and soothe the skin, and help feed the skin the nutrients that it needs to heal.
Absolutely correct.
Perfect. Well, perfect. So is this our last slide that we have to go over as far as where we are at? Yes. So let's look at the 12 weeks, the before and after. If you all can see this effectively, of using the at-home reversion kit and then the Jesner's peels. And this is a 12-week process. So remember earlier I talked about time frame. It's 8 weeks for the cycle of acne, and it's actually 12 weeks for the full cycle of skin transformation. So as we see the before and afters on these clients here, Dr. Beckman, tell us how many Jesner's peels were done on these clients. Was that just one? Did you do 3 or 4? Tell us more about your protocol on each of these patients.
The first patient, a young man at the top, had really severe grade 4 acne. He was a football player, and wearing his helmet, you know, you kind of rub material into the pores. Plus he had that thick, oily complexion. He had a full series of 5 Jesner peels done a couple of weeks apart over a period of time, along with using the reversion products on a daily basis. The girl in the middle, I think, only had 3 Jesner peels, but it was more than just a single Jesner peel. The young lady on the bottom only had 1 Jesner peel, but using the reversion products for her topical product.
Yes, perfect. Great results. The before and afters are amazing. So it's beautiful that we can help each individual client, no matter what type of acne that they have, get them to on their journey to healthy skin, clear skin. So the next slide that we have is, I think, more before and afters of 6 days of use of just the reversions take-home kit and then 1 Jesner's peel. So you can see for her before Jesner's, you can see she has some redness of inflammation. She has more papule pustules. And then day 2, you can see just the overall clarity and the brightening effect that she has on her skin. It's crazy the effects of excessive oil, how it affects the inflammation of our skin. Day 3, day 4, you really start to notice a huge difference. Day 5, and then on day 6, you can actually see where her the broken skin, like the inflammation has completely calmed down. I actually can see the texture of her skin is smoother. Her pores have become smaller. Anything you want to add to pointing out on your patient, Dr. Beckman?
Well, I think if we were to focus on the chin down just to the left of the center line and then the center part of the left cheek, you see two major inflammatory acne processes going on. And to get in a 6-day period of time, that kind of result for those lesions is pretty impressive for me.
Very impressive. Great. Well, at this time, this concludes our Zoom call on unconventional acne treatments. And I hope you all have enjoyed it and learned something. So if Darla would like to let us know of any questions, we'll be happy to answer those. And
okay, I have one question. It was, is Jesner safe for back facials that include tattoos? Will it lift the pigmentation if it's done repeatedly?
Well, I'm not sure I understood your question. I don't know what a back facial is, but
well, okay. If you do Jesners on their back and they have tattoos and you do a series of Jesners, will it affect the pigmentation on the tattoo?
no. Well, tattoos are different. If two kids in high school take some little small needles or something and some black powder and do their own tattoo, that's not a professional tattoo. And those tend to blur and even fade and come off. A professional tattoo places the pigment below the epidermal cell or the epidermal cell layer. So it's down in the dermis itself. And it's a pretty permanent thing. When we're treating with Jesner peels or superficial peels, we're exfoliating only the external layer of the epidermal cells. So it doesn't even get to where that pigment is. So it shouldn't cause any change in that tattoo other than not having acne breakouts.
right.
I don't have any other questions. Next week, we are going to be talking about hyperpigmentation. I think a lot of people are having questions about that. So we are going to set up a Zoom on that for next week. I don't think there's any other questions that are coming through right now. And I know, Bree, that you talked about it. But maybe to kind of just recap on doing acne patients and of being off of like reversion or Accutane so many days before a chemical peel, just to be on the safe side. What do you?
Yes. So, well, and Dr. Beckman, he can speak to this too, but if the client is on Accutane, then they have to be off Accutane 6 months before we do any chemical peel. But that's a Dr. Beckman question as far as Accutane and chemical peels. But we require here that they're off of Accutane for 6 months before we do any type of chemical peel on the skin. Tell us more, Dr. Beckman.
Well, I think that's a good rule. I would break that rule occasionally. I think 3 months is a very minimum, but as long as they're not on Accutane, there's significantly less chance of a significant problem occurring. If you did a chemical peel on a patient with Accutane, you're probably going to get some permanent scarring that you can't fix.
Yes, so do not do it.
Lawyers fix it, but it's not a healthy fix for the provider.
Absolutely. And the other thing is, if we're talking about contraindications and prepping the skin for chemical peels real quick, is the more popular one that they have to stop is going to be retinol or Retin-A. And so we do 7 days. They have to be off of that before they come in for their Jesner's peel for acne.
There's another thing to consider, and that's back in the discussion ahead of time. if they have an allergy to aspirin, they're not a good candidate for a gestional peel because you have salicylic acid as one of the components, and aspirin is salicylic acid, so you could get a cross allergy response.
Yes.
So
Very.
keep that in mind.
Using our reversion products, do you think a couple of days to be off before they do a chemical peel, or do you recommend a few more days?
Well, kind of as we showed in that slide, for preparing the skin for 5 days ahead of time, the first 3 days of those 5 days, sure, use a reversion products, and then the last 2 days just the cleansing portion of it. So yeah, being off of anything that's irritating the skin those last 2 days before the peel is a good idea.
Which is a good point, because I mean, and not to alter the protocol here, but to speak more to that, that's why when they come in for that skin consult, we start them on their reversion kit, and we don't schedule their Jesner peel for 2 weeks until after that initial skin consult, because that gives their skin more time to be prepped and heal with that reversion kit. And then we stop the reversion kit 3 days before they get their peel, like Dr. Beckman was saying, and they just use a new peel, cleanse, and hydrate. So then when they come in and they get the Jesners, it's more effective. So hopefully that helps.
Good point.
Okay, that is all I have, and I just kind of wanted to recap that because I know a lot of people have questions about how long they should be off things. So that's all I've got this week.
Thank you.
We'll see everybody next week.
All right, thanks. Bye.
Bye-bye.